Tuberculosis is a curable disease, yet it kills 1.5 million people every year. With new improved treatment approaches, this needn't be the case.
High-burden, drug-resistant TB countries need to show leadership by dramatically expanding diagnostic and treatment services to people suffering from this disease.
In MSF projects around the world, we see more and more people testing positive with drug-resistant TB for the first time.
У нас в семье болел моего девера сын. У него была устойчивая тоже форма, поэтому я первично и сразу устойчивая форма, потому что от устойчивого больного я заразилась устойчивой формой.
People like Asia are diagnosed using a rapid test which detects resistance to first-line TB drugs in hours. This means they get the right treatment faster, improving their chance of cure and reducing infectiousness. However, its cost and reliance on electricity can be restrictive, and a point-of-care test is still needed. Meanwhile, our teams are out in the community, tracing patients, friends and family to find new cases of TB.
После того, как узнали, что я больна, они все, естественно, сдали анализы, мои дети. Не только дети, мой муж, свекор, свекровь. Вообще я была очень удивлена. Ну, а так, в общем, все нормально, все хорошо, но они должны пить для профилактики лекарства.
Rapid diagnosis and active case finding are crucial in the fight against TB. And as the number of patients grows, MSF has learnt simple and effective treatment approaches.
I think the most important lesson that we've learned in the past years is that we need a patient-centered approach.
Once diagnosed, patients face a long and daunting treatment. However, with the right support, people are better able to adhere to their treatment. And today, adherence is the best form of prevention.
What is very special about our project is that we provide the comprehensive care package to our patients, which includes HIV/TB integrated care. So you have the doctors doing the treatment part, you have the counselors and the psychologists and looking after the mental health of the patient, and then you have the outreach team.
During the first phase of their treatment, if they live close enough, we invite them in, we make sure that we observe their treatment, we give the injection at the health facility. This may involve paying bus fares or public transport allowance.
Providing basic enablers like food and transport helps patients adhere to treatment and reduces default rates.
Lo munye uvele ugcine ade kwale mali yokufika ayothola i-treatment. Lo munye agcine ade ngiko labaningi makhanjwa bagcina bajike endleleni babanga ukuthi engakulukhulu vele nangibuka.
By taking care out of the hospital and into the community, MSF is able to reach and treat many more people successfully.
We try to find a way of supporting them to take their treatments at home. This will involve a community treatment supporter to visit them at their home and to address problems that they're having.
I'm helping them to motivate them to take their treatment well, and I encourage them and I tell them my story, that I've been there, I've experienced this, you will get through it and you will be okay and you'll be like me.
The difference is so palpable and you can actually see it, because patients who have good family support are the patients who manage to complete this treatment pretty successfully.
As well as support at home, psychosocial care and counselling services form an integral part of people's treatment. It helps them to face the stigma and fear associated with the disease and to work through the long and painful treatment.
Стресс в каком смысле? То, что все, я неизлечима, я уже не вылечусь, это серьезное заболевание, ребенок, наверное, у меня будет ненормальный. Были такие у меня. Но при поступлении в стационар я узнала, что у меня устойчивая форма, это меня вообще убило.
It's not easy, but it's that motivation, that encouragement, the support systems that we help them identify to work with, that helps them through it. And when they start having the faith that it is going to work, they gradually start believing it, and that starts showing in their treatment.
Чисто разговоры с ним я успокаивалась, они меня успокаивали. Разговаривая с ним, я уже понимала, да, действительно, все лечится, все излечимо.
Successful treatment is the most effective way to tackle the drug-resistant TB crisis, along with simple yet effective infection control in medical facilities and patients' homes. TB is a curable disease, and the evidence is clear.
I think the key should always be rapid diagnosis and rapid treatment, because within 15 days of initiating therapy, we know that the patient is already less infectious for his family members and also to society at large.
New treatment approaches are a step forward in tackling this crisis, but we face one final frontier. Patients and medical staff urgently need a new and improved treatment regimen. Today, we have a historic opportunity to make this happen.